Welcome to the UK Hair Transplant Clinic. The purpose of this short video is to introduce the very latest non-surgical hair loss treatment that is sweeping the United States. The treatment is called Vfi, which stands for Virtual Follicle Implantation. So, what is Vfi? With Vfi, instead of implanting follicles to grow hair, we implant micropigmentation follicle dots that resemble follicles and make the scalp colour similar to your hair shade. By doing this, it instantly creates the illusion of thicker hair, since thinning hair is only noticeable because you see the flesh colour through the hair. The Vfi treatment involves the use of a digitally controlled needle that applies medical grade hypoallergenic colour pigment into the scalp. Is it like tattooing your head? Well, not really. At a very basic level, there are similarities in the technique, i.e. changing the colour of the skin. Some of the main differences to tattooing are as follows. First of all, medical grade pigmentation, not ink. Although it may appear to be similar technique to body art tattooing, tattoo inks are not subject to the same stringent testing and regulations as the pigments used in Vfi. Okay, the next difference between tattooing and Vfi is that Vfi uses specialist surgical scalp implanters instead of larger tattoo needles. The purpose is to provide a natural look that replicates follicles. On the scalp, you have around 60 to 100 follicles per square centimetre, and so to replicate this, we have to use the smallest of microscopic needles. Traditional tattoo needles are much larger as they are designed to create a solid colour. With the Vfi, the dots are microscopic and these replicate the natural look of follicles. Another difference is that the treatment is performed in a regulated and accredited surgical facility. The whole approach therefore to the treatment is different. Because Vfi is performed in accredited regulated facilities, you are protected from all the surgical guidelines that must be adhered to. For example, infection control policies. If the treatment is performed in a tattoo shop, there is no such regulation. The next difference to tattoos is that the procedure is performed by a trained specialist surgical assistant and not a tattooist. At UK Hair, the treatments are performed by specially trained surgical assistants who have years of experience of implanting follicles as part of their surgical hair transplant team. They therefore understand the physiology of the scalp, and this is essential if you are to produce natural results. Typically, a tattooist has no formal recognised accredited training, even as a traditional tattooist. So, who is a good candidate for this treatment? This is an ideal treatment for 1. Patients who are not clinically suitable for hair transplant. For example, patients where the visual thinning is due to the miniaturization of the hairs, i.e. quality of hair, as opposed to where thinning is due to space created by dead follicles. In those instances, we could perform a transplant. Also, even though a patient may well be suitable for a hair transplant, once we've looked at the donor area at the back of the head, we might find that the follicles are not a good enough quality to survive the process, and therefore if we move them, they simply wouldn't grow. Another good example of where the Vfi treatment would be a good choice is where the patient doesn't have enough follicles to cover the whole area. So for example, when we have patients who are what we classify as Norwood 7, which is extremely bald, and they need 7,000 follicles, and we can only harvest about 5,000 follicles from the back of the head in the donor area, then we might want to 1. Do a full Vfi transplant. And this replicates somebody who has got hair and they've shaved it off. It's sometimes referred to as the buzz look. If you'd like any information on Vfi or any other of our hair loss treatments, please click the link below.